Okay, well let's get going. Good afternoon, everybody. Welcome to our weekly webinar series where we're looking at different facets of reopening schools and planning ahead for that, be it next Monday, 9 weeks from now, or whenever it may be in person. So as you know, many of you, we've been doing this series since April and working with school districts and state facilities directors and folks from around the country with different vantage points and perspectives. And recently, what we've been focusing on here is the built environment, where it's particularly on HVAC and indoor air quality and some of those concerns and topics. The past couple weeks ago, we talked with folks at the Green Building Council about some general principles for healthy indoor air quality and healthy built environment, and then spoke with a facilities director in Pennsylvania who's done some testing on the new ASH rate standards and what's feasible for their planning in the fall. Then last week we had the facilities director for Colorado Springs District 11 come on and talk about their HVAC assessment that they did, their audit on looking at the built structure on the louvers and the whole system itself, dampers and so forth, and the actuators as well as the controls, making sure that those are working as needed. If you missed that one, there's some great tips on that we were able to glean from Josh's presentation there. So you can check that out on the website. And hopefully many of you got the response in email where we dove into some of that filter grid, that graph that we had some questions on in the last one, tried to address that in the email invitation that went out yesterday. So with into today's conversation, as a natural build off from those discussions, also wanted to look at the cleaning, disinfecting, sanitizing side of the fence, and how some of these items dovetail with our concerns around indoor air quality. And we're lucky that we've had as a participant in our webinars for some time, David Lipton with the North Carolina Department of Health and Human Services, who's an industrial hygiene consultant and has specialized in working with schools and other institutions on the interplay of R&M, repair and maintenance, good keeping up with the facilities, capital renewals, and their impacts on IAQ, indoor air quality, and just and healthy indoor environments. So David has a wealth of experience here as a certified industrial hygienist, 8 years with the state Occupational Safety and Health Division, OSHA, 26 years with the Division of Public Health. And he said, you said David field about 1,000 calls a year on different questions, concerns from folks about their indoor environment and how to address problems and so forth. So we're really excited to have him here. And David, thanks for being on. So David, could you maybe just introduce yourself a little bit and
Sure.
Maybe fill in the gaps that I had, and then we'll get right to the discussion.
Sure. Like David said, I'm a certified industrial hygienist, and I'm actually, we're actually in the epidemiology section of the North Carolina Division of Public Health. So we share the communicable disease group is one of our sisters. Preparedness and response is our sister branch, that kind of thing. So we originally started out more as an occupational health program, but we transitioned primarily due to some of the natural disasters, more to dealing with indoor environmental quality stuff. And so over the years, the vast majority of my questions that people call me about start with, I've got mold in my, take your pick, home, school, office, and I don't know what to do. Can you help me to deal with it? So that's kind of the lens that I look at stuff from. And there is a group of state indoor air quality officials that's through the Environmental Law Institute, and it's sponsored by the EPA. And about every 18 months we get together, and we've been doing it for over 10 years. And actually dampness and mold growth is still one of the #1 topics. But there's other ones that are out there that are interesting, and it's a really good group of individuals from around the country that we have we share a lot of good information. So if you can go to the next slide, please.
Sure. And as we get into it, I'm going to get out of the way here, folks. David has a wealth of information and knowledge on the topic we're going to talk about. So as questions come to mind as he's going through his presentation, I'm going to mute myself. I'm going to monitor the chat box and field those questions onto him. So please, as they come to mind, put in your comments, put in your questions,
Do you
and
get
we'll
to
address them as we go.
Do you get to advance the slides, or do I get to?
I have that control right now, so you
Perfect.
just let me know, and I'll
Perfect.
be your Vanna.
So in 2009, I had an opportunity to attend one of the initial training classes by a group called the National Center for Healthy Homes. It was called the Principles of Healthy Homes. And the whole point of this training, it was 3-day training, and it really informed how I thought about the indoor environment. But those are the 7 or 8 principles, with the idea that if everything works together, and if you keep a building dry and clean and well-maintained and in good repair and pest-free and contaminant-free and safe, you create a good place to live or work or go to school, and everything works together. So it's looking at the system, it's looking at the people, it's looking at their activities, and it really informed me, and it made a lot of sense in terms of looking at the total indoor environment. The top 4 really are the most important: dry and clean and well ventilated and well maintained. But the others play into it too. And if you, the beauty of this model, which has been adopted by HUD and EPA and CDC, is that you take care of multiple hazards at once, and it's integrated. And so especially for things like people with asthma and stuff, you take care of multiple things with one set of interventions. So it's really, and it really has informed on how I've taken to look at buildings. And I guess what's really important here, I think people don't understand about cleaning. So I have a book that's actually about 25 years old. It's a book called Protecting the Built Environment, written by a researcher named Michael Berry.
Figure out my multiple screens here.
So he defined cleaning as it's an environmental management activity where basically you're identifying and extracting and collecting and removing and disposing unwanted stuff or contaminants. And I think that that's a real important part that people don't totally understand what clean and cleaning means. And I think that's one of the more important topics that I think is really important in how we reopen schools and how we take care of the built environment. And the other part that kind of is, to me, is also, well, we've talked a lot about ventilation, but the contaminant-free part is really important too. And we've made tremendous progress in getting rid of one of the biggest indoor air contaminants in lots of buildings, which is secondhand smoke. But we generate a lot of indoor contaminants through materials and products and all sorts of things. And we do want to try to reduce the burden of other chemicals in the air, and that points out to cleaning. So if you can move to the next slide, I think that there's a huge difference between cleaning and disinfecting, and I think people get it confused whether intentionally or unintentionally. But they are totally separate activities, even though there's a lot of products that you can do that are labeled for cleaning and disinfecting. And so it's really important to be thinking about when you need to clean, when you need to sanitize, and when you need to disinfect. And that what comes with that is reading and understanding the label instructions. So dwell time is one thing that everybody's concentrated on. And quite frankly, I see it really difficult to use disinfectant wipes and keep a surface wet for 4 minutes. I just don't see people doing that. So what's the point of using a disinfectant wipe when you can't meet the dwell time to make it really do disinfecting? You probably do get some cleaning action. But the same thing, in the rules for our children's environmental health, it's specific that when you disinfect a food contact surface, if you're using bleach, you got to keep the surface glistening for 10 minutes. I don't think most people do that. The other part is you got to be aware of what kind of material you're disinfecting. They're not most disinfectants can't work on porous surfaces. So, you can't really disinfect carpet or drywall or leather or other porous materials, paper, that kind of thing. Some disinfectants need to be rinsed. And in the school environment, it's really important. Most every disinfectant product has on its label, keep out of reach of children. So we don't want young children using disinfectant products. They've got to be stored in a locked manner or in a way that kids can't get together. And we don't want to mix products intentionally or unintentionally. So cleaning actually is quite effective, and you got to have a clean surface to get good disinfecting activity. And it turns out that a lot of soaps and detergents, they're surfactants and emulsifiers, and so they help to lift stuff off a surface. But they actually do attack the envelope, the fatty envelope or the lipid envelope on some viruses. So there might be some virucidal activity. Sanitizing is you've reduced germs to a safe level, whatever that is, and disinfecting is killing germs. And there are times and places where you absolutely need to disinfect, but there's lots of other times where good cleaning or sanitizing will be more than effective. So if I can move to the
so David, yeah,
okay.
actually, let me drill down and ask you a question as a novice to this particular topic. I get the difference, cleaning and disinfecting, different ends of the spectrum, and I get that. That makes sense. They're different things. If I'm looking at providing guidance to a district on a cleaning schedule and sanitizing and disinfecting, when and what are the considerations to distinguish between when you should sanitize and disinfect? Because I get the fact that we should clean our surfaces and get the impurities and the dirt off it. And if you don't do that, you're not going to be able to do the other two things effectively.
So I guess,
yeah, I'll stop there.
I guess the best example that I could give would be for food surface. So you've got dirty dishes or cooking utensils, right? First thing you got to do is you got to scrub them and get all the fats and oils and detergent and all the stuff off of them, right? Then you run them through a sanitizer so that you're reducing the germs on the surface, right? And then you put them up, and hopefully, I think one of the biggest violations of the food code is putting up wet dishes or wet utensils. But then you put them up and you let them air dry. They are not in any way, shape, or form sterile. There's a few bacterial fragments on, the dishes that you put up, but they are sanitized so that there's no pathogens or very few pathogens. And you really need to do that step for food contact surfaces. So that's kind of, that comes from the lens of food safety. And of course, there are parts of things in food safety where you've actually physically got to disinfect stuff. Does that help you in any event? Does that help you?
It does, and I'm trying to think of, like, if I'm a teacher, and my kids are coming into the room, and one cohort comes in, and another cohort's going to come in after that. Do I need to think about, I need to clean, like these desks, they should be cleaned, or they should be sanitized, or do I need to disinfect? Like, what my day-to-day level of just sort of keeping let's go to a general classroom. What should I be thinking about doing daily, weekly?
I think that cleaning really needs to be done very frequently. So you would absolutely need to clean touch points and contact surfaces in your example between cohorts of students. And in my mind, cleaning is not perfect, but you're getting stuff off the surfaces. You're getting any, and I think there's other things that you might want to worry about besides COVID-19 viral particles. You know, there's
Right.
bacteria, there's dead skin cells.
Right.
There's, I mean, you know, the microbiome is pretty complex, but cleaning does a pretty good job. You can get removal of, you know, 90% or more, especially if you use something like a microfiber rag and a decent soap or detergent. You can get a really, really good removal of that stuff from surfaces. And so, you know, there's probably some things that probably need to be cleaned in between use. I think that sanitizing is kind of in the middle ground. I think that one of the speakers talked about, one of the facility managers talked about a lot about sanitizing, and then through his lens, the idea was that we want to reduce germs on surfaces to levels that are not a hazard, and I think that's a reasonable goal. I think that disinfecting, the big thing, one of the package of materials I sent to you was some guidance from the restoration industry, who are getting into this stuff in a big way, getting into environmental cleaning in the big way. And they're all about making sure that their clients know they can apply a disinfectant to a surface and it can be disinfected, but there's no guarantee about it in the future. So, you know, that points back to the idea that cleaning is going to have to be something, you know, like we're told now to wash our hands all the time, just about after we touch anything. Well, kind of after we've touched something, that surface almost needs to be cleaned all the time. And I think that might help to kind of put things in perspective. Is that a reasonable answer?
Yeah, and I think that, and you're going to get into this, I think, in a later slide too, is just the not relying on disinfecting everything all the time. Like you can go overboard. But what is something that is effective? What is something effective that I can do in a reasonable schedule? Yeah.
And I think this goes to the point that first, you can't sanitize or disinfect a dirty surface. They don't work on, you know, they don't work despite what people will say. And these products really, you know, people don't look at them. In my mind, I look at them just like any other kind of pesticide product. And in fact, they are antimicrobial pesticides regulated by FIFRA, the EPA, which is the Federal Insecticide, Rodenticide, and Fungicide Act. You know, so they are, so, you know, that means that the label's the law, and that means that when they put down on the label, you know, what you can use them for and how to use them, that's a legal document. And so, you know, at least from my lens of looking at molds, we get people that call me all the time. I was told to clean mold off the surface with bleach or kill mold with bleach. Well, if you read the label from bleach and you look at what molds bleach has been tested against, it really only kills two types of mold. It kills Aspergillus niger, and that's a mold that stains building products permanently. And I can't pronounce it right. It's Trichophyton mentagrophytes. I can't pronounce it, but that's the mold that
better than I would.
That's the mold that causes athlete's foot, which is a communicable disease. Clorox cannot tell you if they will kill any other kind of mold because they haven't tested it against it. But that goes to the point that you know, with the understanding some about the EPA-N list, which is the list of products that are effective against the SARS-CoV-2 virus, basically the manufacturer just has to say, our product, we've tested our product and it can inactivate viruses that are harder to inactivate than the SARS-CoV-2 virus, which is not very difficult to inactivate. And if we've already proven that on our label, then we can put it on your list. But I think the point is that I look at those, in my mind, they're all in the same lens as, you know, applying an insecticide or an herbicide or anything. They're they are antimicrobial pesticide products. And I don't think people get that too much. And you want to really minimize the use of those things. Is that helpful?
Okay. It is. And that's something that I just downloaded from the EPA, this list. and sorted them by type of cleaner as you go into that a little bit, and I'll send that to everybody in the group here in a little bit. So thank you.
So we know that,
And then
hand washing works, and we know that we don't use antimicrobial soaps. One of the most common antimicrobial ingredients, triclosan, got banned from use in hand soaps within the last couple of years, and it got banned from all sorts of consumer products. We know that soap and water and physical activity gets rid of stuff off your skin. We know that, and it works really well. And we don't suggest using fragrance soaps. Why add an extra chemical when you don't need to? Why add something else to the environment? There's lots of people that are chemically sensitive. So, good old soap and water is an amazing product. And especially if you follow the instructions for 20 seconds, you vigorously rub your hands together, you rinse and, thoroughly, and then you use a clean hand drying device or paper towel. It's very good at removing stuff from your hands. Again, it's probably about a 90% or greater effectiveness. And it doesn't necessarily affect good germs that are present on our skin all the time too.
Mm-hmm. Right. And that speaks to this topic that you were sharing with me, which is you can go overboard. It's
real easy to go overboard. And when I've looked at all these various reopening plans and various cleaning plans, it really, it's a partnership, because to me, I see, especially in a school environment, but even in my office environment, it's very clear that our custodial staff, they've made it real clear what they're going to clean and disinfect. And they've also made it clear that anything that's the contents that belong to us, we're going to be responsible for. And they're also not going to move stuff around. So if I leave my office cluttered, if there's something they're supposed to clean, they're not going to touch it. So really, you've got to partner with your custodial staff, and you got to try to make it as easy as you can for them. And custodians work really, really hard. But you need to partner with them, and both everybody needs to know what they're supposed to be doing. And you can really overboard, go too much with disinfecting. The world's not sterile, and you don't necessarily want to kill every germ on a surface, but you do want cleaning. And cleaning's innocuous. It's relatively non-toxic products, and it gets rid of stuff on surfaces and bacteria. All the viruses are different, but bacteria and molds don't grow on clean and dry surfaces. So, microfiber is really important. I see a question popped up about foggers. There's a lot of debate about the foggers. My personal opinion is, and what we have tried to do in our materials on our website, is we've tried to say only use a product if fogging is listed on the label as an approved use. And they do have an advantage that they can, you can apply a product and you minimize the amount of product that you use. It can stick to surfaces and get dwell time. But I guess I would also read the label, because sometimes those products need to be wiped off the surface after a while and some don't. So read the label is about the best advice. In my mind, I think that fogging is a bit overuse. Maybe if you're careful and you target those touch surfaces and target the places that really need to be fogged or electrostatic spray applied, that's okay. I would come back to what people who do integrated pest management say, that if you're going to use a pesticide, which is part of integrated pest management, you use it in a way that you get a benefit, and you use it in a way that's environmentally friendly and that targets the pest. So there would be no reason to fog or mist a floor, for example.
So that actually, David, goes to the previous question quite well, which was, can we address the frequency of disinfecting high-touch surfaces such as door handles and entrances in a school? So if you're looking at, going back to that cleaning, sanitizing, disinfecting, how should we think about that most harsh, disinfecting on high-touch surfaces? Is this a multiple times throughout the day, daily, weekly? What goes
I
into
would
your
say at
calculation
least
for
once
that?
a day. But
Once a
again,
day.
I think that's something in a school environment, you kind of want to control who uses hazardous chemical products. So that's going to be something that is probably going to be something that the custodians do, because hopefully, they're going to control the inventory. They're going to be trained on how to use the product appropriately. And so that would be something that the custodians would probably be doing. Maybe I think once a day at least would be the minimum, and preferably maybe when after people are gone, so that you get adequate dwell time. I don't think there's any really good. I think every situation is going to be a little bit different, but I think that disinfecting is primarily going to be a custodial function, and cleaning is probably going to be a function of teachers and others. There was a question.
Right.
There was a question that popped up about ultraviolet light, and I would say the same thing again. That ultraviolet light can be a good disinfectant, but that's not cleaning, and you still need to get the stuff off the surface. So,
okay.
I don't really.
And would the same hold true, David, for hypochlorous acid? I mean, I've heard of this as well being an option. I don't know if that's on. I don't believe it's on the EPA, but the CDC rather. CDC a list of cleaners, but maybe you could speak to that.
It is, and actually, even before before the pandemic, some healthcare facilities are using hypochlorous acid. Basically, you mix it up. Some of them are proprietary, but basically you're generating the hypochlorous acid as you use it, and some healthcare systems are using it, and I think they're using it to pretty good effect in hospital facilities. But I think they are doing cleaning before that, so they're using it, as an after. They're not just hosing down a surface with a hypochlorous acid solution. They're physically cleaning first.
And one of the things that would speak, I would imagine, similar to that, at least once a day for high touch surfaces.
At least once a day.
As a baseline, regardless if it's hypochlorous or if it's some hydrogen peroxide solution or if it's fogging or whatever it is.
I think at least once a day would be a good recommendation. You could do it more frequently, but I think that would be the bare minimum. Okay. And again, I hope, we hope that there's multiple layers, because, and at least in our building, we're starting to see signs all over. After you use the microwave or hit the elevator button, we want people to either use hand sanitizer or wash their hands. So hopefully you're adding another, between both those layers, you're getting, you're not getting viral products or other contaminants on your hands.
Yeah. One of the things that your comments have really brought to mind is the wait time and how long something has to sit there, and for the disinfectant to work is simply using a disinfectant wipe and not leaving it wet, as you say. If it's not sitting there for whatever 4 minutes it is not doing its job. And that does not the CDC list, doesn't it provide you the time that each of these cleaners need?
And for whatever it's worth, when hand sanitizers were being developed, the reason that people picked less than, I think it's either 60 or 70%, but they picked that because if it's more than 70%, you squirt it on your hands, it's going to evaporate so fast it won't get any disinfecting or sanitizing activity. So interesting. So 60 or 70%, your hands will stay wet long enough for the dwell time, so it actually will do sanitizing.
Interesting.
That's one of the more interesting pieces of
Yeah.
trivia that's out there. Plus, it's a flammable
Yeah,
liquid
that's a good
too.
little factoid. Sure. Oh, that's another issue that I've heard is you brought that to my attention quite a while ago about, the challenge of having, a large amount of flammable liquid on a bus.
Yeah, and in North Carolina for buses, for school buses, they're not allowed to have any flammable materials on a school bus or attached to a school bus. So when they were thinking about how to use hand sanitizer, they could not attach. The transportation director for our Department of Public Instruction was adamant that unless the policies changed, you could not attach a hand sanitizer dispenser on a school bus because it's a flammable liquid. So they had the workaround was that either the driver or the attendant would carry enough hand sanitizer with them for the trip they were taking and would apply it. But they were very adamant about not attaching flammable products.
Fixing it, right. And storing it, right.
And storing it, yeah.
Amy had a question about water fountains and cleaning. So what are some considerations that you could provide about the good hygiene around a water fountain?
Oh boy, I'm going to have to punt on that one a little bit, but I think that's probably something that probably needs to be routinely scrubbed and cleaned and disinfected. I guess a lot of places they're shutting up. They're either they're shutting off the water fountain part and they're having people use bottle dispensers.
Right.
But I would think that even those surfaces they would need to be, and they're stainless steel, so they are eminently cleanable and disinfectable. So, I think that was something that I'm not really sure how frequently they would have to use it, but I would definitely put that on the list of things that are going to be touch surfaces.
Sure. Okay. So maybe a little extra vigilance there. Use filling stations if possible, sort of inferring in lieu of water fountains. Is that?
I think that's right if you can, but then again, money's tight and you may not be able, if you multiply how many of those you got to go through in a school or school system, that's a bunch of plumbing changes.
Right. Yeah.
That's another question that popped up about the microfibers. I think that microfiber cloths do need to be cleaned routinely. They need to be washed, and they need to be washed separate from other kinds of linens and textiles, because the lint from the other textiles will clog up the microfiber. Yeah. Some of the microfiber materials have like nano silver in them, and that's primarily to keep them from stinking. That doesn't do anything about viricide stuff. But again, you can, they're cleanable. You can squirt soap on them, scrub the hell out of them themselves, run them through the washing machine, let them dry, and I think you probably, they attract stuff, but they also are cleanable themselves. We love them at home, and a lot of people also love microfibers because of their ability to trap soils and the ability for them to be cleaned.
Yeah.
Sometimes people will have they'll have multicolored microfiber cloths so that they use them for different surfaces. That's another thing that people do. Or that's a way to tell which ones, if you're using like a wipe and toss method or a 3-bucket method, you could have different colored microfibers for the different parts of the cleaning process. So that's another way that you could reduce cross-contamination too.
Yeah. Just shaking my head a little bit about the water fountain challenge, because that's sorry to go back to that, but that's a real big one. They're important. You got to drink water, and they're everywhere, and it's the standards in so many places, and it just stands to reason that if you can replace them with water filling stations, great, but then you've got extra trash and other secondary issues there if you don't have water bottles. Then it's a matter of, if you can't replace them right now, signage, just like we're putting signage everywhere about standing 6 feet apart and, wearing a mask and so forth, signage about how to safely use a water fountain. Don't put your mouth on the thing. Let it run for 5 seconds before you drink out of it. Something like that. I mean, I'm just waxing philosophic here, David, but I think that's it's a challenge for a lot of schools.
I absolutely agree on that.
Yeah. And Amy just doubled down on it. We can't afford to bring in bottled water for everybody every day. But, you know, kids bringing in water bottles, it's not, 6-year-olds toting their own water bottles is going to be challenging.
And there's some other issues with that too, because water bottles themselves, you know, you've got to clean them periodically, and
right.
There's not really any good answers. I will be talking a little bit about heating and air conditioning systems some. I think Josh Chisholm did a really, really good job on covering some of the topics without probably better than I could do. He did it. That was a fantastic presentation.
He was great. So Ted, to your question, if you want to look at that one, there's a link to that in this presentation, which we'll send out, but you'd also go to our company's website, which is coopstrategies.com, publications, and then at the top of the videos column there's a link to Josh's video there. So
I would say that you know, if I could say one thing about heating and air conditioning systems, I would not recommend that a school system go with ultraviolet light systems. I just there's no doubt that in healthcare, like in tuberculosis wards and stuff, that they work, but I think that you need an expert to design and install it, and you need an expert to operate it and maintain it. And I don't think that there's that many experts out there that can do that. And there's some downsides, because ultraviolet light, you know, it can cause thermal burns, or you know, you want it to make sure that that's effective. I think I know that there's been really good success when you shine an ultraviolet light onto a heating and air conditioning coil, and especially if you have good pre-filters, that it keeps fouling and it keeps microbial growth off of the cooling coils. I don't know much about the induct systems, but intuitively in my mind, the air's moving too fast through the air duct to get enough of an irradiance to kill anything. And you still need good filtration on top of that too. So I wouldn't. Okay. I would stay away from that as much as I don't think it's worth it.
Interesting. That's really, you know, and that's similar. And here's the link to Josh's and that Amy just sent. Thank you, in the chat box. But one of the things that was really an aha moment for me and Josh's presentation last week too was, you know, you can operate. Okay, you want MERV 13 filters. Many of them aren't going to fit. You know, and if they are going to fit, you have to get those electrically static charged ones, and then those have a shorter shelf life, and you've got, you don't know exactly when they're going to go out, and then you've got, you know, if you want to bring in a whole lot more, you know, fresh air, you're going to be running your system harder, which can break it down faster, and all of these other things to think about. And it's as you're saying, or with disinfecting, you can disinfect too far. So, you know, we can't just swing the pendulum in one direction on these different things completely to an extreme and hold it there.
I think with filter changing, and if you think about the logistical challenges that a school system might face, every building's got probably different kinds of filters, and maybe even different kinds of systems or filters within a building. And so the logistical challenge of keeping all that stuff in stock, getting somebody out there to change it. They're not necessarily located in places where they're easy to get to. You know, it turns out to be a really, really big logistical nightmare, and expensive too. I've heard of a school system in North Carolina that had a budget of $500,000 just to change filters on it, you know, routinely. And I guess that's one of the disadvantages of going more towards units that serve only a couple classrooms at once, because then the disadvantage is that you make more filters. I would stay away from ionization. The question just popped up, and the reason that I would stay away from ionizing, and the reason I would stay away from that is because even though they say they don't create ozone, they probably do. And also the ions, the charged particles and the charges will react with other chemicals, and you might have some unintended chemical reactions and end up with more irritants than you intended when you started with. So I'd stay away from ionization, and I can get some literature about that for you.
So you UV and ionization, UV, you're saying you got to do that right, or you go hard or go home. It's got to have an expert down, and that's limited, a scarce resource. So use cautiously. And then air ionization, unintended consequences there. And I'm here just going back to make sure your system's working right, and get the right filters for your system as high as they can go to have it still fit the system, and make sure it's working as it is intended.
A few weeks ago, I was listening to a presentation by Claire Barnett from the Coalition for Healthy Schools, and when she was talking about ventilation, I think she said it probably better than I could. Compared to a lot of places, the heating and ventilation systems, air conditioning ventilation systems in schools are relatively low tech, and so try to keep that in mind. I think is really important. And again, from what Josh said, he did a fantastic job of explaining about some of the unintended consequences and how they actually I think they found a really good balance for what they, to make sure that they figured out what was working. And I think they made a really good point about making sure that things work and comparing it. If you have a building automation system, that, it could be a problem if somebody's sitting there looking at a computer screen and they say everything's working, but there's a linkage broke. So the motor worked, but the damper didn't move. I think that's a really, and I think I think I might have a picture that you've got in there that can show kind of how you can unintentionally fool a thermostat.
I have some of your photos in here. I didn't have all of them, maybe, but yeah, that was one of the points, having physical eyes on it, and your,
if it's not there, maybe we'll get to it. But we had a classroom where they were continuously complaining it was too hot or too cold. Well, what they'd done is they'd located a bunch of computer equipment underneath a sensor for a thermostat. So they had fooled the thermostat, and that's why they never felt comfortable, but the building automation system said everything was working like it was supposed to.
Right.
So I go out to schools relatively frequently. And when I'm out there, I'm looking for things, I look for short-term things, but I'm trying to look at the big picture, and I'm trying to look at stuff. I don't really often open up equipment or stuff, but I try to look at things. And these are actually pictures, all these pictures I've taken over the years. So I look at this is actually a middle school, and I'm saying, if they don't now, they're going to have a drainage problem against that wall, because you've got the plant, you've got the water running downhill, you've got water trapped against the side, nothing is totally waterproof. There's going to be a moisture problem in that wall assembly over the course of the life cycle of the building. And that kind of, that might be a harder problem to fix based on what they've got, but I look at that and I see that as maybe a long-term problem. Then on the short-term problem, they're out there mulching and they cover the downspout from the roof with extra mulch. So they got a wet spot by the side of the building, and plus they've covered up the weep holes. So if water gets inside underneath the brick cladding, it's not going to drain away, or it might wick back upwards into the wall assembly. And if you look in the top of the picture, you can see that the normal ground level, and they've covered the weep holes. So that's probably not a good thing. But again, I try to look for really obvious things. This picture, the woman whose classroom was served by that unit was complaining about allergies. And it's like, we went outside, we looked at the outdoor air intake, and we saw that there's this downspout right next to the outdoor air intake, and it's green with algae, and the brook's green with algae. No wonder she's complaining, right? So you want to keep the outdoor air intakes. You want to bring in clean air into the building if you can.
Yeah.
So I think that's crucially important. And another area, I don't think I have a good picture of it, but that's sometimes an issue when you have a lot of when you have a bus yard or a carpool line that is too close to the building. There's been a lot of work on anti-idling policies for school buses, and also for people picking up and dropping off kids because of the auto exhaust emissions getting entrained into the building. So North Carolina, it's a hot and humid climate. We see this pretty routinely. You see this line of staining that's in it's a line. The suspended ceiling tiles are obviously in bad shape. They need to be removed, but you don't really, this is where you want to go above the ceiling, because when you go above the ceiling, if you can go to the next slide, what you'll see, I think you've got it there. What you'll see is that's a chilled water line for a heating and air conditioning system, and it's above a suspended ceiling where it's really, really hot and humid. And so even unless you have the perfect insulation job with everything lapped and sealed and water resistant, you're going to have a condensing surface. And so things are going to condense, and then the water is going to drip down, and you'll see that linear pattern on the ceiling tiles, or maybe you'll see it scattered out where there's bends or elbows, or maybe where there's fire sprinklers above the ceiling or something. But that's an incredibly difficult problem to deal with in our climate, where it can be 140 above a suspended ceiling, and you've got 45-degree chilled water, or even if you have room temperature water in a fire sprinkler system, the temperature difference is such that you can have condensation without too much trouble.
And this is just, again, speaking to, sort of the theme which is emerging here is, that when it comes to COVID and, air quality, for example, and in circulation, go back to your basics and get those all right.
Exactly. So, obviously you don't want to, that's disgusting if you happen to see, if you open a piece of equipment and you see standing water. And from the complaints that I get from residents and from other people, I would say one of the number one complaints I get is my air conditioning flooded. So, I think one of the previous speakers was talking about how they were very careful with their fan coil units to make sure the condensation drains were working and everything was clean and tidy, and that is a preventive maintenance issue, and you've got to keep the water draining out of the drip pans underneath units. So this picture, I took a picture. You can see the black tubing, that's the condensate drain, and they kinked it. So you're going to have a flood there eventually. That was in the wintertime, so it wouldn't, so I mean,
preventative things.
Yeah, preventative things, and that's pretty easy fix. I guess you've got a couple more slides. This picture, I took this picture at a modular unit. So they had a packaged barred unit on the outside, and they didn't really think about how to get rid of the condensate. And there's a lot of water dripping out of those units in the summertime. And you can see that the water is dripping out, and you can see down, if you move the mouse back up into the picture, you can see how the water is actually kind of dripped down, and it has caused damage to the siding. So I'm not sure what I would do there. I think, I'm not really sure. I'd have to look in more detail, but I would definitely think about trying to extend the tubing through the deck, and at least maybe even all the way to the outside, so it's not causing a bunch of so you're not creating a huge wet area. But they generate a tremendous amount of water. Then you see things like, they've blocked a heating and air conditioning vent unintentionally because there's crowding and clutter, and that's always a huge problem. And I think the last picture, I think there is a picture of the, but you don't want, but people do that, or they'll block returns. And then the last two pictures, it's been my experience that, especially with younger children, classrooms just get incredibly cluttered. And everything in that class, well, there's a bird cage in there, which is probably not a good thing.
Yeah.
But all that stuff in there, they're dust magnets, and they're hard to clean. They, stuff accumulates, and it's a big challenge because obviously you want to have kids engaged, but at the same time, if you're keeping stuff, and I gotta admit, if you look in the background, my office is terribly crowded and cluttered. But there is something to be said for reducing clutter and making it easier to clean and promoting good airflow. And decluttering is free, and it's a challenge.
Yeah.
It is a huge challenge for multiple reasons.
Yeah.
But it can add benefits. You're getting rid of dust reservoirs. You're making it easier to clean. There's some actually people feel better when they're not terribly, well, the thing is that Amy says they're saving on the custodial hours. The custodian might actually just walk right in, empty the trash, and walk right out, truthfully.
Right.
And you can't blame them for that.
Yeah. Right. Yeah. So decluttering, Bonnie, right, might be the silver lining in all this. But yeah, the need to do that, and the use case for doing that is strong, and maybe this can actually do it. And I know a lot of folks I'm working with have done this to the nines for the cleaning, disinfecting reason, and also, frankly, to maximize the usable space in the room. Coming back
that
to
too.
Capacity and social distancing.
Or maybe for people with feng shui, they feel better when they have a clean and well organized space too.
Yeah. I long for the day when we concern ourselves with feng shui.
Yeah. But I think there are lots of good benefits to that. And I think it's a huge challenge, and believe me, I have to face that problem every day, both at work and at home. That trying to put stuff in its place, trying to declutter, trying to reduce, reuse, recycle, and but I think that it's the way to go, and I'm working on it slowly. So I think that pretty much covers my presentation. I hope it's been helpful for people. But I do try to look at, I guess I do try to come back, and I do try to think about the total environment. And I do try to come back to this idea of those healthy homes or healthy building principles. And I realize that, you're still going to have problems, but what you want, you want a place where people that tends to promote health and health and well-being, that and these healthy home principles, if you look at them together and you think of them as all working together, it does kind of give you a pathway to think through all this stuff. And I found it to be really useful whenever, in dealing with this, and in dealing with my normal work, and with dealing with all the complaints I get from people across the way. And I do think fundamentally, that's the whole reason we have buildings, because we want a place that tends to promote health and well-being and productivity. And this is a pathway to get there.
Right. So I really appreciate it, David. And I'm really grateful that you've been a part of the conversation and willing to be interviewed and talk today. And I really bring that let's get the basics right first approach to the cleaning of the environment, like we did on the HVAC last time. And these principles handy. It's good to have a list. We can go off a checklist. My big takeaways, David, are that list, and this is just good, healthy built environment, and then really understanding more of the nuance and difference between cleaning, sanitizing, disinfecting, and what kind of schedule. Clean very often with good soap. Don't use the antimicrobial or all the extra perfumes and dyes and all that kind of good stuff. And sanitize and disinfect at least once a day your high touch surfaces.
I think that's pretty good. I think that's pretty good advice.
Yeah. And then, well, folks, thanks so much for your comments, your questions. And David, again, thanks for being here. We will, as with everything, we'll record this. We are recording this. We will put it up on the website. We'll take that that Excel sheet of the CDC guidance, and that's sorted for you, and put that up there. It's publicly available.
And I would have
we'll
no
look
problem
forward
if
to the
somebody
conversation next week.
And I would have no problem if somebody wants to contact me directly for any questions.
Sure.
Okay.
Do you want to just put, because we'll send out the chat, David, can you just throw your email in the chat box there?
Sure.
And then that way we have it on record in this chat file, and folks can reach out to you.
Okay, I'll see if I can do this. I have to move my computer out of the way.
Decluttering.
Yeah, well, I have
All right, everybody.
to,
Well,
and thank you. You did a fantastic job of pulling all that stuff together.
oh, my pleasure.
Thank you.
There you go. There's David's email right there. Have a wonderful day, everybody. Stay safe. Have a great weekend, and look forward to talking to you next Thursday.
Thank
Take care.
you.
Thanks
I
again,
really
David.
appreciate the opportunity.
My pleasure.
Thanks.